Okay, great. So thanks everybody for joining us today. Appreciate everybody connecting on what I think will be a very helpful and informative session for members of the Canadian Nuclear Isotope Council. For those of you that don't know me, I'm James Skonyak, and I'm the chair of the CNIC. And I really wanted to take a few minutes and really just level set why we're having today's session. As people know, the Canadian Nuclear Isotope Council just over a year ago launched our Isotopes for Hope campaign, really exciting campaign with the focus of continuing to assert Canada's leadership role in the production, the development, and the use of life-saving medical isotopes. And we all know how important these isotopes are to communities and industries and people all over the world. And one of the key elements of our Isotopes for Hope campaign was really focused on doubling Canada's production of medical isotopes by 2030. And a lot of the sessions that we have had as the Canadian Nuclear Isotope Council have been very heavily focused on ensuring that reliable production and that supply of isotopes. And that remains absolutely important. But from a leadership perspective, I'm really glad that today we have officials from the International Atomic Energy Agency who have joined us, who are going to walk us through what I think is a really important initiative called Raise for Hope. For those of us that work in the nuclear industry, and my role as the Chief Operating Officer here at Bruce Power, I can tell you we have a very strong relationship with the International Atomic Energy Agency. And I always view the IAEA as the regulator of our regulator. So they play an important role in terms of setting international standards for nuclear safety. The Canadian Nuclear Safety Commission then aligns to international standards. And we as operators align to, first and foremost, not regulatory standards, but standards of excellence, which we always aspire to go higher than regulatory standards in everything we do. But our relationship with the IAEA as a sector here in Canada is so important. But in addition to a lot of those activities the IAEA carries out, they also have a very important global mandate when it comes to, obviously, the peaceful use of nuclear power. But this Raise for Hope, I think, is something that is incredibly exciting. People, those of you that know me, you know I'm a pretty direct person, and frankly, what I'm hoping we as an organization will learn from this Raise for Hope presentation today is have a greater understanding of the work that is being done internationally through Raise for Hope. So that people who live in countries that are still developing, that are still growing, that are still increasing their prosperity, we have to recognize that there are literally billions of people in the world that do not have access to the same kind of cancer diagnostics and treatments that we as Canadians have become very, very accustomed to. And I always like to reflect on the fact that on, I think it was Saturday or Sunday, Melody, we celebrated in Canada the 73rd anniversary since the first cobalt beam therapy treatment was carried out. I shouldn't say beam therapy, but the first cobalt treatment that was carried out in London, Ontario. And that's a very exciting milestone. But the thing we also have to reflect on with that is now viewed as an older technology 73 years ago. But there are literally hundreds of millions and billions of people in the world today that do not even have access to that treatment that we had in London, Ontario 73 years ago. And so our goal as not just Canadians, but as people who want to make a better world is we want to see more people around the world have access to these important isotopes and these important treatments. Because just like we always like to say that 100% of us as Canadians will be impacted by cancer in our lives, whether it's ourselves, our loved ones, family members, and friends, will all be impacted by cancer. And that is not just the case for Canadians, it's the case for everybody in the world. And so when people are faced with those challenging circumstances, we want them to have access to the best. And so I'm really excited to hear about the Raise for Hope campaign work underway. And to our friends at the IAEA, we really appreciate your leadership broadly, but taking time to be here. And I will just call a spade, that I think Canada needs to do more in supporting Raise for Hope. And I'm looking forward to traveling out to Vienna later this month. I know we have an event with the CNIC and the IAEA. I'm hoping we'll be able to sign an MOU or something formal. But the message I'd give you to the IAEA is you have our commitment that we have a tremendous amount of very positive engagement with the government of Canada. And so one of the things we want to learn out of this is what can we as the CNIC do? What can we as organizations in the CNIC do? But mostly, what can we as Canadians do? And I know our government would be very open to doing more in this space because we've really tried to increase the profile and the understanding of what we're doing. So again, thank you very much for being here. And what's most important is not the great information and what we're going to learn today. It's going to be about what can we do about it to support the amazing work being done at the IAEA. So I'll leave it at that. And I think I'm passing it back over to you, Melody.
Thanks, James. So just wanted to welcome everyone formally to the webinar today on behalf of the Canadian Nuclear Isotope Council. My name is Melody Greaves, and I'm the Manager of Business Strategy here at the CNIC. And as James mentioned, today we're hosting this webinar to talk about a really important topic for us, which is improving access to cancer care and radiotherapy infrastructure around the world. As we all know, Canada has been a leader in this space for many years, which now presents us a really important opportunity to start to look at new ways that we can share our expertise and spread our leadership with other countries. While we are all aware that isotopes are rapidly becoming the standard of care for cancer patients around the world in many countries, there are many countries that still lack the facilities, the infrastructure, the personnel that's needed to really deliver these life-saving treatments and diagnostics. So the IAEA's Rays of Hope campaign really presents Canada with a significant opportunity to have a long-lasting global impact on the international healthcare community. So with that, I'd like to welcome 4 presenters from the IAEA who are here to talk about the importance of this initiative, its impact so far, and how Canada can take a more prominent role globally. I'll mention that after the presentations, we will have a good amount of time for some Q&A. So I would encourage everyone to put your questions in the Q&A function throughout the presentations, and we'll make sure that we can address those towards the end. Our first presenter today that I'd like to introduce is Lisa Stevens, who is the director of the IAEA's Program of Action for Cancer Therapy, or PACT, as part of the Department of Technical Cooperation with the IAEA. Lisa will be providing us with a bit of a high-level outline of the sustainable development work and the Rays of Hope campaign as a growing international initiative. So with that, please welcome Lisa.
Great. Thank you so much, James and Melody, for those introductory remarks. We've got a team here that's hopefully going to give everyone a flavor of what Rays of Hope is really trying to achieve. It's one of the flagship initiatives that our Director General has launched. If you go to the next slide, or do I have control? Oh, great, thank you. As Melody was mentioning, we do support sustainable development. Although many people may know IAEA as the nuclear watchdog, I do want to highlight that for more than 6 decades, we have been supporting countries in the translation of nuclear technology, nuclear applications, to support their development. We have a few flagships that are mentioned here, Atoms for Food, which is one of our newest ones, New Tech Plastics, which is looking at plastic pollution in the ocean and plastic recycling and how we can use nuclear technologies to support that. Zodiac, which was launched right after the pandemic, looking at zoonotic diseases and how we can track and hopefully prevent them. And the one we're here to talk about today, which has the most real estate on this slide, is our Rays of Hope initiative, which is looking at how do we support countries to either initiate radiotherapy and diagnostic imaging or expand so that there's more equitable access. Next slide. As James was mentioning, we're all touched by cancer. And we do know through the GlobalCan data that over 70% of cancer deaths are occurring in low and middle income countries. And yet there's only about 5% of global spending on cancer in these low and middle income countries. And the map that's in the bottom of the slide You don't have to see the borders or anything, but just note that those dots represent available radiotherapy equipment. And so you can see clusters and concentrations of availability, and you can see huge swaths of land where there is not an available radiotherapy machine to support patients with cancer. And we've calculated that about 50 to 60% of individuals with cancer will be directed to radiotherapy at some point in their treatment journey. We have a goal to support SDG 3, reducing the premature mortality related to non-communicable diseases, including cancer. And we want to do this by increasing the equitable access to cancer care. We want it to be timely, we want it to be safe, and we want it to be available. We're using innovative technology to support cancer in countries that we see as underserved. So how do we work with the medical infrastructure? How do we determine best use of funds to support training or procurement of equipment? And all this is really to expand the access to the diagnostic imaging so that you have a timely and accurate diagnosis, nuclear medicine, and radiotherapy. Next slide. So in a nutshell, what is Rays of Hope? At the Program of Action for Cancer Therapy, which is the division I lead, we're supporting Rays of Hope across the entire agency, and very specifically through these baseline assessments. So the impact reviews are assessments that we do at a member state invitation in conjunction with WHO and the International Agency for Research on Cancer. And Joelle's going to give you even more numbers, but since the inception of Rays of Hope, we've supported 22 of these baseline assessments in countries that want to understand what are their gap areas in cancer care and how can they develop prioritized needs in conjunction with Rays of Hope. We also support national cancer control plans, 16 to countries, again, that have aligned to Rays of Hope. The main aspect of Rays of Hope is really equipment and training. So we have these assessments, we have these national strategies, there are prioritized needs, and then we're able to work through our technical cooperation program, which are national, regional, and interregional projects on a 2-year cycle to support training. And so far, 80 cancer care professionals are being trained under Rays of Hope. We're supporting countries with decisions and guidance on the construction of cancer centers. In some instances, this is the first center for radiotherapy in the public sector in countries. And we're also have been able to support 25 member states with radiotherapy or medical imaging equipment, again, through our technical cooperation project. We've also seen that having a network of regional centers, or what we're calling anchor centers under Rays of Hope, that can help countries with training, that can provide experts for quality assurance missions, and also that can contribute to research and innovation, perhaps to support resource-sparing treatment. So using hypofractionation, fewer treatment cycles, so that the capacity of the machine is expanded and more patients can be treated. We have been able to raise 70 million euros to date to support this training and procurement of equipment, the assessments. And again, I think through this conversation, we're looking for additional ways to engage interested partners. So I go to the next slide and I turn it over to Joelle.
Thank you, Lisa. Good morning, everyone. Joelle Salé, pleasure to meet you. I'm the Rays of Hope, very lucky to be the Rays of Hope coordinator, which is really a fantastic initiative that we're leading here. So how do we concretely provide support to our member state? It can take various forms, and I will provide some specific examples to illustrate each of those. But first and foremost, I mean, we build capacity and capability in our member state by providing them with fellowship opportunities. And these can either be short-term fellowship or long-term fellowships. As an example, with our partnership with GE Healthcare, we were able to send 11 fellows from African countries to University Hospital Zurich for a 4-week clinical fellowship program at the Department of Nuclear Medicine. In terms of long-term fellowship, an example, through our partnership with Roche, we sent 6 medical physicists from Kenya and Senegal to complete a 3-year training in medical physics, 2 years of a master's course, and then that was followed by a year-long clinical training. And as Lisa mentioned, since the launch of Rays of Hope, we've been able to initiate training of over 80 medical professionals in the field of radiation medicine, so radiotherapy and medical imaging. Training courses, we also provide training courses to local participants. As an example, I can cite the training we've organized in Kenya with a national training course targeted at the regulatory body to upskill the regulators on regulating radiotherapy practices, considering the radiation safety and security of radioactive material that is also in scope. We also trained professionals in mammography techniques and readings and so much more. In terms of research, we have a state-of-the-art laboratory in Cybersdorf where we conduct research so that we can also share technology broadly with our member states. I will cover a bit more later on the anchor centers with whom we're also looking at these anchor centers to support their neighboring countries with access to research as well. In terms of meetings, we organize events to promote exchanges of ideas and best practice. And earlier this year, we've organized a Rays of Hope forum where we really convened 350 individuals from the agency, from our recipient member state across all 4 regions. We've convened, current prospective partners from private sectors, international financial institutions, civil society. And the idea is really to get together, share best practice, discuss challenges, and brainstorm what more can we do so that we can together tackle the growing global burden when it comes to cancer. We conduct expert missions, and Lisa talked about the impact reviews, which are really a prime example of these expert missions and a great example really of cross-department coordination internally, but also how we coordinate with our UN partners, WHO, the IARC, to address the full spectrum of cancer control so that our actions are not isolated, but really integrated and cover the continuum. Another example is the development of strategic documents, and these are really close to us because these bankable documents are in fact, thorough, member state-owned, IAEA validated techno-economic feasibility assessment and really tools that the member state can use to be instrumental in their mobilization of resources. So these documents are detailed, they're validated by the IAEA and really cover all areas from physical infrastructure, regulatory framework, human resources capability, cost-benefit analysis. And so the IAEA supporting member states with development of these bankable documents also have an impact on the resources that the member states can mobilize to meet the huge cost of either initiating radiotherapy for the first time or expanding radiotherapy facilities. We also support member state participation in events. For example, we are sponsoring 160 participants from low and middle income countries to attend the Radiological Society of North America virtual annual meeting in this upcoming December. So these are great examples of support to the Rays of Hope initiative and the activities that we do. Next slide, please. So we've launched Rays of Hope in February 2022 with 7 African countries that we called our first wave countries. And most are listed here, you can see them. And these are countries where, in the span of 2.5 years, we're already seeing results. So I'll talk about some of these, but I just also want to flag that since then, we have now 44 African countries who have requested support under Rays of Hope. And at a global level, we have 92 countries who have requested support. So we are helping in Africa, but also extending our support across our 3 other regions. In DRC, DRC does not have any public radiotherapy center. So this is a good example of us working in parallel to support DRC. So we've provided them with support in the development of the bankable document that I mentioned earlier. And they are successfully leveraging this document to mobilize resources with a IFI for the construction of the radiotherapy center. But we're also complementing this work by training their medical physicists in Morocco. In Kenya is another good example. We are supporting the training of 6 medical physicists, but also we're supporting with 6 radiation oncologists at the University of Nairobi. These are the numbers that you were referring to, Lisa, too many numbers. We've procured and delivered 2 linear accelerators to support Nakuru and Mombasa, which had no radiotherapy machines to date. So these are really a good example of an impact that we are having within a limited span of time. And thanks to the support of all our partners, of course. Benin is not mentioned here, but as an example, Benin got financial support from a French bank for the construction of radiotherapy and nuclear medicine facility, which is now in progress and close to completion. And we've complemented that by procuring a cyclotron and inspect CT. So and we've also conducted training and qualified 19 fellows for Benin. So these are another example. Malawi have secured national resources again to construct bunkers for radiotherapy and brachy. And we've complemented that with training, long-term training, refreshers courses. We've also delivered equipment. And Malawi, we are expecting Malawi to open their first public radiotherapy facility by the end of the year. But our support, as I said earlier, also goes beyond Africa. In Latin America, we have procured 32 mammography units, and these are being delivered to 18 countries in the region, and that will allow the screening of 250,000 women per year. So really, with Rays of Hope, we are supporting with procurement, capacity building across our 4 regions. And this is all very encouraging. And I would say a testimony that when we work together and we're able to pool our resources, we can achieve. And hopefully we can achieve much more going forward. Next slide, please. So Anchor Center are a key element of the initiative. The big change, I would say, or one of the important flavor of Rays of Hope is sustainability, is an essential element. So how do we ensure sustainability by establishing Anchor Center? So they're really a novel approach, and these are cancer centers that are already collaborating center with the IAEA, and they have the capacity to support their host country as well as their neighboring countries with capacity building, provision of expertise, by organizing training events, by improving quality assurance, by being part and participating in research projects. So we're really aiming for these centers to be expertise and knowledge hub for their respective regions. And they're also a great example really of South-South collaboration. So when we support Anchor Center, we're ultimately supporting Rays of Hope recipient countries because they provide, among other things, greater access to those specialized long-term training. On the map, you can see 10 Rays of Hope. Well, on the map, you can see 9, but we've added the 10th one that we've designated in the last General Conference. We've got 3 in Africa, Algeria, Morocco, South Africa, 4 in Asia Pacific, Japan, Jordan, Pakistan, Thailand, and 2 in Europe, Slovenia and Turkey, and another one in Latin America and the Caribbean with Argentina. And more are on the way. So these are really important elements that we also want to support. That was it for my side. I now hand over, is it to Diana?
Thank you, Joelle. Yeah, thank you, Melody and James as well. Thank you, Joelle. Yeah, well, I'm happy to be here. My name is Diana Rubin. I work on partnerships and resource mobilization here for Rays of Hope. And as you've just heard from what Joelle presented, we can see that the needs are very high with over 90 countries who've requested to be part of our initiative, of our Rays of Hope initiative. And they've expressed overall needs of around 230 million, which they require to set up or improve their cancer care facilities. So when we look at our success and our, what we've achieved since the launch of Rays of Hope around 2 years, almost 3 years ago, we've been very successful actually in terms of fundraising since the inception. As you can see on the diagram here, we've raised around, let's say, 1/3. It's the 70 million that Lisa mentioned initially of the overall needs of 230 million, which is not too bad in just 2.5 years to cover the needs expressed by our member states. Now, just to clarify that most of the funding that we've received so far for the initiative comes from what we call our traditional partners, meaning our governmental donors and partners. And of course, and that's referring to what James said in the beginning, we would of course love for the Canadian government to join this effort as well. We have 17 donor member states so far. You see them listed on the slide at the bottom. But of course, we need more partners to fund the equipment, the training, the expertise that Joël just elaborated for the activities that we're conducting. However, governments and our governmental donors and partners cannot and should not shoulder, the bulk of the responsibility alone in terms of supporting low and middle income countries in their efforts to build more equitable access to diagnostics and treatment. And so this is why we are increasingly strengthening our efforts and our outreach as well, our partnerships with what we call non-traditional partners, meaning the private sector. And we've already had some really nice success stories on such partnerships. You can see the logos on the slide. You see Elekta, Siemens Healthineers, PTW, Standard Imaging, and many more. And we're increasingly conducting outreach activities like today's online briefing for these stakeholders who may not always be aware about this initiative and about these areas that the IAEA is actually engaged in on a global level. And my colleague Mark, and that's my handover to him, is going now to highlight the different ways that the private sector or our non-traditional partners can actually engage with our initiative and display some concrete ways of how you can come on board and support.
Thanks a lot, Diana. It's a real pleasure to be here. My name's Mark Hanbury, and I also work in the partnerships team, covering the kind of private sector partnerships. I think it might be helpful also just to briefly take a step back, just to say that here at the IAEA, we really do understand that we need the private sector's help to be effective and to achieve the goals of Rays of Hope. We need your expertise, your innovation, your R&D capacity, global reach, and so on. And in fact, I'm really pleased to say that our Director General has made this cooperation an absolute priority for the organization, including for Rays of Hope, and that our team has been asked to lead the charge in this direction. And that's why in 2023 and 24, we took our, first steps to a more structured approach to cooperation with the private sector. And as you saw on the previous slide, we signed partnership agreements with various companies, which allowed us to then take a more longer term and strategic approach to this cooperation, where we can combine our strengths to amplify our joint impact. I'll turn to this slide itself. As you can see, there's lots of ways in which we can collaborate. Financial and in-kind contributions, yes, obviously, as you can see from the previous slide, the needs are substantial. So any contributions in that sense would be greatly welcome. However, it's also important to highlight that we're looking for partners for multiple reasons, and there's a number of ways that we can work together and collaborate under the umbrella of Rays of Hope. I think in particular, I'd just like to draw your attention to the last point on the left, which is this new perspectives on challenges. I think for many of us in the agency, this is actually the key point, that we recognize the IAEA doesn't have all the answers, and maybe in some cases we're not even asking the right questions. So we really want the private sector to join us on this journey, to help us, to give us new perspectives. We can also learn from your experiences and to join forces to tackle common challenges that we're facing. So I think that's it'd be good to have some time for questions and further discussion. I think I can leave it there. Obviously, I'm more than happy to go into a bit more detail about our cooperation with the private sector, but just to emphasize the point that our doors are really open to cooperation with you all. And today is a fantastic opportunity for us. So I'll leave it there. Thank you.
Thanks so much to all the presenters for all this really interesting information. I think one of the earlier slides included a statistic that over 70% of cancer deaths occur in low and middle income countries. And I think that really sets the stage for why this campaign and this topic is so important, And for us, why Canada, as a global leader in terms of production and research, has a responsibility to step in and help and work to improve access around the world in partnership with leaders like the IAEA. So I'd now like to open the floor up to some questions. We've already got a couple that have been rolling into the Q&A function already, which is great. But I'd like to invite anyone who hasn't yet submitted a question. If you're curious to ask our presenters anything, please submit it below and I'll make sure that it's raised. The first question that we've got here comes from Ralph and talks about the deployment of some of this technology. So in terms of developing and deploying highly specialized things like medicine and nuclear medicine, how is the IAEA planning to utilize or is already utilizing artificial intelligence to help improve care delivery?
I can start on that one, and I don't know if Joelle has anything. So we are certainly looking at AI and how it impacts our ability to deliver things in the member states. We also have a whole technical team that focuses on human health that is looking at, they just held a conference on diagnostics, but also utilizing AI in treatment planning and doing remote treatment planning. So it's definitely something that we're looking at with both across the agency and some of our external partners. But I don't have a definitive answer for you other than, yeah, we really need to look at how to better deliver through the utilization of AI.
Thank you. Anyone else want to chime in on that? Diana or Joelle, perhaps?
No, I just wanted to say that for us also anchor centers will be instrumental in that relaying the AI technology to support, their host countries and neighboring countries. So this is work in progress, but hopefully in the near future we can share more information on that. But anchor center definitely, as part of their innovation research package, have this already in their work plan.
Thank you. Our next question here is also a little bit forward-looking in terms of where the campaign might be headed next. So when we think about deploying and improving access, we also have to consider improving the deployment of the entire supply chain and some of that expertise that comes across the supply chain. So in terms of capacity building and working with national governments and the anchor centers, is there any focus for the future on areas like building capacity in radiochemistry and radiopharmaceutical development to support the deployment of nuclear medicine in these lower and middle income countries? And then the second part is there any focus on supporting the development of guidelines for compounding and manufacturing of radiopharmaceuticals?
Okay, I'll start with that one again. So for sure, radiopharmacy, and we have had trainings. I know we had one in Francophone Africa for training in French for radiopharmacists. We currently have an intern with us who was a Marie Curie Fellow, and she trained in radiopharmacy. She's Kenyan, and she will go back to Kenya after her year at IAEA. So it's definitely an area that the IAEA has expertise in. But I would say if CNIC has the capacity to help us train more radiopharmacists and the radiochemistry and the compounding, that would be fantastic. The intern that we had, we shared her with one of the technical departments that looks at the pharmacopoeia and what WHO is putting out in terms of publications on some of these radioisotopes. But I think there's definitely more to do. So that could be another aspect of this partnership agreement that James mentioned at the beginning, how to partner with the division that's doing the physical chemistry, as well as other aspects of Rays of Hope.
I mean, CNIC is a growing organization. We've got over 100 members now, I'm very happy to say, and a good contingent of our members are radiopharmaceutical experts and leaders in radiochemistry. So I think that that's certainly an area that Canada can lead and can support this initiative specifically. The next question here is in terms of what would be most useful to IAEA. So we've got a question about what types of isotope-related equipment, what types of training specifically would be most valuable to the program, if there's something in particular that you're prioritizing at this time?
So what I'd say is, I think this would be, to Mark's point, like the jumping off point for the next conversation. So again, we have the whole technical team that could go into, what are some of the prioritized needs for the various countries. Joelle mentioned that Benin, we've supported them. They'll have their cyclotron, I think, installed by next summer. So there may be specific trainings or support around the deployment of that cyclotron, other countries that are looking at that. But I think if there are different entities within the umbrella organization that say, oh, I need more information specifically on this, what type of support could be offered, that would, I think, would be a second conversation. We could bring some more of the technical experts around the table, even if there's a specific country or a specific region that's of interest. We could bring all of those elements to a follow-on conversation. I don't know, Mark, is that?
Yeah, no, that's perfect. I had the slide before where I presented a couple of big picture points about how we can cooperate, but certainly the way we go about what I mentioned about these strategic partnerships agreements is it really is a process of getting to know each other from the agency side and the potential private sector partners side, and we all have our own kind of characters or our own ways of working, and we like to make sure that when we do go firm in signing agreements with partners, that we have mapped out very concretely all of the ways we can bring our strengths to the table on the training, or whether it's through a donation or sharing of information. So this certainly would just be a first step, and then we definitely welcome further follow-up discussions with individual members or the council itself to look at where we would go. And there's a lot of directions we can go in, as we said before. Thanks.
Yeah, I just want. Go ahead, Lisa.
No, you go ahead, Joelle.
No, I just wanted to add, yes, I mean, to Mark's point, there's lots of direction we can go, and there is no shortage of needs. And it's again about making sure that we just find the commonalities between your organization and ours so that we can best support our member states. But we have needs across region, across countries, across disciplines. And to Mark's point, advocacy or outreach or in-kind or financial or even discussion on guidance, on brainstorming on various ways can also be useful. So yes.
Yeah, the other point I was going to make is that Joelle mentioned we had the first Rays of Hope Forum this past February. It was here in Vienna. Our plan is that the 2025 forum will actually be in one of the countries in the first wave. So that part of in addition to sharing progress and ideas and talking about, what those needs still are, we would be actually able to visit one of the sites that has benefited from Rays of Hope. So again, I would invite any of the interested entities to reach out. We can have conversations between now and whenever the date is for the Rays of Hope Forum. We don't know yet, but we're honing in on the dates and the location.
I think that's a really unique opportunity, not only to see the impact that this has had so far, but also to understand better some of the additional challenges that might be faced. I know we've touched on a couple of things already during the Q&A session, but understanding what those challenges are and how we can work together to overcome them. So in terms of, a lot of our questions here are very much based on the excitement of where we can go with this, because as you've all mentioned, there is a lot of need for this campaign and for additional support. So in terms of the next chapter of this campaign, how are the next wave of countries that will be the focus area going to be identified once the first 7 are addressed? As Joelle, I think, mentioned, there's 92 countries around the world that have requested access and requested support through the campaign. So how are you going to operationalize who gets access and to what?
I guess that's for me. So first of all, I want to say that on the first wave, we are now, thanks to the support of our partners, we have managed to close the priority needs. And I think that's a very important story to share. And it's recent, as of 2 days ago. So that's really encouraging. And the process or the pathway of Rays of Hope is fairly straightforward, but it always starts with an impact review, which is the baseline assessment of the country needs. And based on this is a very comprehensive, detailed tool that allows us to know what is the cancer profile of the member state, what are the priorities. So we really leverage this assessment to be able to narrow down those activities that will have the most impact. And the other principles that I would say is that we apply an equitable prioritization. So we aim to cover all of our 4 regions. So we have an identified priority 1 list with the needs already estimated in close collaboration with the member state, based on the impact review and based on input from our scientists, our technical departments in-house. We also meet with the regulator in country to make sure that all of this effort is coordinated. So the safety and security is an essential aspect of this initiative, and we haven't flagged that enough. But that's really part of the multidisciplinary approach, I would say. So we already have a list of next wave or next priority countries with their needs already estimated baseline. And so what we work on very closely with the PRM team is these are the needs, very specifics. These are the proposals that have been cleared internally. And when there is a desire to support, we have this information readily available that can be shared with prospective partners. So that internal process has already been done, which puts us on the forefront to be able to react quickly to the needs.
Thanks, Joelle. Anyone else want to jump in on that one? No. Oh, sorry, Lisa, go ahead.
I was just going to say the only thing I'd say is that the pie chart with the estimated needs is conservative and only on some of those, first wave countries. So we definitely see the needs and the interest growing. And, as we branch out more into some of the Asia Pacific countries, some of the European countries that have expressed interest, and we're, finalizing those proposals, then the denominator is going to grow.
And if I can just add to this, sorry. So we also have, there are different ways that we go about this, but we also are working now on a thematic approach, on breast cancer, on childhood cancer that cuts across many countries, across the 4 regions. So that's also another way of looking at it, is rather than going country by country or region by region, we are bringing together that needs because we have received input from our partners that this is something that they would like to chip in, collectively towards an agreed target. And I think there's this emulation that goes on with these thematic proposals that's very promising.
Just to also piggyback on that one. I think when you see the pie chart, it's so massive and the needs are overwhelming themselves. And I think Joelle hit the spot there in terms of trying to narrow down the focus to focus on a specific kind of theme. And she mentioned a couple of the proposals. Other proposals that we also have is with regard to the anchor centers, and maybe that seems also to be of interest to some of our private sector partners. So, and that's also an area that we can explore collaboration on. Thanks.
I think it's interesting because we did have another question that came into the chat about initiatives to provide access in areas like Northern Canada. Understanding that Canada is not classified as a low or to middle income country, but there are disparities in terms of access depending on which region you go in Canada. And so I think that looking farther into the future, leveraging campaigns like this to improve access, not just across countries, but within countries, to make sure that no matter where someone lives, they have access to this life-saving diagnostics and treatments. I think that collaboration opportunity is really interesting to us as well. In terms of what you consider to be the other major challenges in improving access in these countries that you've worked with so far, aside from the infrastructure and the facilities and technology, and aside from the personnel and sort of the focus areas that you've had so far, What would you consider to be the existing challenges that you're facing in terms of disseminating access, and how are you working to overcome these? I know, kind of for an example, I know that transportation of isotopes and of materials can be quite challenging in some of these countries, given that flight routes and things like that between countries in Africa might be quite limited. So what would you consider to be those continually pressing challenges that you're facing?
Right. So let me start in, and this is why the impact assessment is done across the whole cancer continuum, because it's not just about, like you said, Melody, training 2 people or procuring a machine, but it's how does this fit into a system? And when we were looking at some work in the Caribbean, that was one of the things that we were looking at, were the flights. Not necessarily for transport of isotopes, but transport of people. So if there wasn't a cancer center on a particular island, what was that patient pathway? And we've looked at that. We have one of the team members here is a nurse, and so she's quite familiar with that patient pathway. And looking at countries that don't have a facility, or this was their first impact assessment, how can we start when there's nothing on the ground? So I think it's mapping the patient pathway, but in a slightly more specific context, one of the challenges we see is machine maintenance. And that might be outside the scope of CNIC, but I just want to put it out there that it's something that has been raised to us because, again, you put this infrastructure around radiotherapy or diagnostic imaging, and if the machine is not maintained and it breaks and it doesn't work, you can't diagnose, you can't treat, and you're no better off, perhaps even worse off than you were before that machine was in place. So we're really looking at this. How can we work with maybe new financing models, different partnership models, uptime pricing, different ways to approach this so that the machine is available for treatment and diagnosis.
Yep. Melody, if I may just add to what Lisa said, and this comes now, of course, from my partnerships and resource mobilization perspective. One of the challenges that we face, like really globally also, is a competition for funding, and a competition because of competing global priorities we are all looking at, we're all considering, and which we all find super important. I mean, it's true, right? Like climate change, all of that is challenging, urgent, and all of that. So, and the funding is out there. But it's also a matter of visibility, and it's a matter of making for example, the work that the IAEA is doing, but also other global players and other partners on the global cancer burden visible and also interconnected. So that's why, and only if you're visible, you can also, of course, reach relevant partners for potential funding, right? If nobody knows about the great work you're doing, then they will certainly also not fund you. So this is why we're also conducting some, not only, of course, an outreach exercise and a lot of work and spending a lot of time and effort on online briefings with potential new partners and stakeholders like CNIC and its members, but also in global fora, in fora that we were not, or the IAEA was not so visible or so present so far, to be recognized also as a global player in health, in global health, because people, and I'm not only talking about private sector stakeholders, but also governmental players. They are in capital, they are sometimes not aware of our complementary role that we play to support and in conjunction with WHO, the World Health Organization, on cancer. As Lisa said on the very first slide, more than the world's nuclear watchdog. That's true, because if you think about cancer, the world, if they know about the UN and the relevant organizations, they think WHO, which makes absolute sense. It's totally true and important. However, 50 to 60% of cancer patients need, of course, radiotherapy, as you all know. And so the element or the niche or the very specific mandate that the IAEA is providing from a UN perspective needs to come into play and needs to be connected. And that's why we're also working on being visible, you know, at high level fora, like I don't know, the UN, you know, the HLPF in July next year, for example, focusing on health, yeah, high level political forum, and as well as on UNGA, you know, the General Assembly. These are global fora. The world is looking at New York in September, and the IAEA, or even Davos, you know. This is very important, because otherwise you can keep doing your work very efficiently, but you're not effective, because you're not really reaching the people you want to reach. So.
Yeah, I think it's an interesting point when you talk about being visible, and then to Lisa's earlier point about ensuring that it's a sustainable visibility and sustainable financial models of this, and making sure that the countries that we're not just deploying this technology, but that we're setting them up for long-term success, so that they can take the technology and take the tools that they're given, and really grow that and make that a successful model, and then hopefully disseminate that leadership out to other countries as well. I've just got one last question that I'm hoping that you can touch on, and specifically thinking some of the work that will come from this partnership between CNIC and the IAEA, hopefully to get the Canadian government and to get provincial counterparts more directly involved and more formally involved in this campaign. And as James mentioned, that's something that the CNIC is very proud to be taking a more formal position on, and taking a leadership role to encourage our governments to participate. In terms of efforts to collaborate previously, what have you considered to be the roadblocks that have prevented Canada from supporting or becoming a member of this campaign in the past? And then do you see any opportunities for provincial governments or municipal governments or Indigenous communities coming forward to help address those roadblocks that you've identified, to better persuade the federal government to take part in this initiative?
Would you like me to start, Diana?
Go ahead, and then I'll chip in.
I mean, so I've been with PACT for 5 years, a little over 5 years, not as long as Diana has, but it mirrors the issue that Diana was mentioning. You know, IAEA has strong health work. We do collaborate with WHO, but WHO is recognized as like the health entity in the UN system. And so when we approached, I think it's called Global Challenges Canada. Is that the name of the entity within the Ministry of Health? Anyway, maybe Diana can remember in her memory banks. But there was a big focus on HPV prevention through vaccination. And when we were talking about what we were doing and, you know, expansion of radiotherapy access, there wasn't a lot of interest from the Ministry of Health. So it's almost, you know, making sure you get the right interlocutors around the table, that you have health, WHO, IAEA, CNIC, you know, so that you can really see the full story on both sides of the table, right, from the UN and from the national perspective. To your other point, I mean, so we're open to partnerships, and I think it's more, you know, how would the Canadian government, or, you know, the Canadians organize that interface with what we're doing here at IAEA. And to a previous question that you mentioned, Melody, I think, you know, for the Northern Territories, the Canadian Partnership Against Cancer is a group I've worked with for, you know, more than a decade, and they might be, you know, nationally a way to engage for improved access to treatment just within Canada. So I think you have sort of the gradations of access across, you know, all the land and the various centers of populations, and then how does Canada come together and interface with Rays of Hope, you know, with the UN in terms of access to care. So I hope that wasn't too long-winded and twisty.
No, if I may just add to that one, yeah. So of course we you know, this is touching upon the very first question I also asked myself when I joined the agency around 8 years ago. I was immediately looking at our counterparts in capitals, right? In our donor member states or potential donor member states. So which ministry is actually, to which ministry are we talking? And I realized that it's not the one that I suspected first, the Ministry of Foreign Affairs or Development Cooperation. In Canada, it would be the Global Affairs. That's what you were referring to, Lisa, before, Canada Global Affairs. But it was mainly, of course, not exclusively, but mainly the Ministries of Energy. And so, of course, that's this silo effect that we also see and that we have to tackle. I think this is a challenge that we have to tackle when we involve the permanent missions, the permanent representation of Canada, for example, based here in Vienna. They understand, of course, they are super aware of what we're doing, the health-related work, the development cooperation work that we do. And they do a fantastic job relaying this back to capital. However, it's our job also as IAEA, and we've tried to look at that when Canada launched its feminist, the first one ever, actually, feminist international development policy. For us here, we looked at that and we thought, this is fantastic because as Joël and Marc referred to, we were, since many years, for many years now, we've been looking, and now we are bundling it under Rays of Hope, but we have been looking at thematic, at marketing our cancer work also via thematic thematic areas. For example, women's cancers, right? Breast, cervical cancer, fantastic, would be a perfect match. And so we referred that when we were trying to engage with the Canadian counterparts in Canada Global Affairs. However, there is still this very, very strong silo effect I mentioned already, that that is happening both here but also in the different capitals, where we need ministries to more talk to each other and to engage with each other, and if they hear IAEA, to not just turn away just because but to actually be open and to see that we are also doing development cooperation work. We're doing health related work, not just not just energy. And so, yes, by looking at these things, by looking at the government, the potential donors, thematic development cooperation priorities, we are, of course, customizing it and packaging it in a way that they can be receptive to that. And we're trying to work more and more on that one. But of course, if this is something that CNIC could help us, work on and help us package it even better, so that this initiative, our Rays of Hope initiative, talks even better, or can be communicated in a way that really talks to the stakeholders in capital, so much the better. Maybe that's all we need, to take that step.
Yeah, I think it's an interesting challenge in Canada and other countries as well, because medical isotopes and radiopharmaceuticals and all the infrastructure required doesn't just neatly sit in one particular ministry or one particular portfolio. So it does require that sort of cross-disciplinary, interprovincial, interdepartmental collaboration. And so I think that that's a bit of a unique thing that CNIC very much can bring to this, to support the initiative further, because truly, as a historic leader in this space, Canada does have a responsibility to step up a little bit more. Recognizing we've just got one moment left, I wanted to take a quick second to thank our speakers from the IAEA for joining us today for this really informative webinar. I know I learned a ton about the initiative, and it's, I think, a really exciting place that we can go together. I wanted to take a quick moment to flag a couple of events that are coming up for CNIC, if anyone is interested. The first one James alluded to in his opening remarks. At the end of the month, the CNIC will be at the IAEA's Ministerial Conference on Nuclear Science, Technology, and Applications. We are going to be delivering a side session on November 27th about how Canada has leveraged its technology, like the CANDU nuclear reactor, to produce very high volumes of medical isotopes for the world, and why this is important in terms of reliability and security of supply. So if anyone is attending that conference, I would encourage you to reach out to us so we can make sure that you're included in that really exciting workshop, where we'll have a series of different CNIC members delivering some really interesting presentations. The other event, just to make a quick plug, for anyone who has participated in our Leader Summit, I'm very pleased to say that the Canadian Radiotheranostics Leader Summit is coming back to Toronto in 2025 on June 12th and 13th. This is a really interesting forum to bring together both the nuclear supply chain, the isotope industry, radiopharmaceutical companies, academia with clinicians, all in one place to discuss common issues and opportunities for the future. So I would encourage everyone to keep these dates in mind. Opportunities to sponsor and to participate are now available. So if you're interested, please reach out to myself or my team. And with that, I once again want to thank the IAEA for participating in this webinar. As I mentioned a couple of times, the CNIC, through our Isotopes for Hope campaign, is going to be calling on the federal government and the provincial counterparts to formally participate in this to help close the gap in access to cancer care around the world. And I think that by leveraging some of our existing expertise and existing leadership in this space, Canada can truly have a deep global impact on the global community in this space. So with that, I'd like to thank everyone for joining us, and we will see you at another event very shortly.
Great. Thank you so much.
Thank you, everyone.
Thanks. Bye-bye.